we know that patients with COPD have a lot of cardiovascular risk factors. They often have conditions such as diabetes, hypertension, raised cholesterol. And then what we're increasingly seeing in the evidence is that patients with COPD, when they have an exacerbation, which is a worsening of their lung function, that during those events, and now what we see is for a period after those events, that they are at quite considerably increased cardiovascular risk, and they're at increased risk of a wide variety of cardiovascular events, and that includes worsening heart failure, what we call acute coronary syndromes, arrhythmia, and stroke. So the EXACOS-CV study is a multi-country study using databases in each country. The advantage of that is that it examines real-world patients. And what we've done is we've looked at patients who have an exacerbation of COPD and followed up for those 4 key outcomes. So heart failure, myocardial infarction, stroke, and arrhythmia. And we've also looked at split up whether the exacerbations are what we classify as moderate or whether they're severe and they required hospitalization or an emergency room visit. And what we see is that there's a greatly increased risk of all of these events following an exacerbation. It is increased for up to a month following a moderate exacerbation, but that risk is actually increased for up to a year following a severe exacerbation. And the advantage of this study compared to other studies is that it's sort of generalizable and replicable across these many countries, that it shows us real-world patients, that it gives us that granularity around the severity of the exacerbations, and it shows us the association with that wide variety of different cardiovascular outcomes. The first is awareness that as healthcare professionals, we all need to be aware of that heightened cardiopulmonary risk in patients with COPD. And we need to think carefully about exacerbations and consider them as an important and a preventable risk factor for future cardiopulmonary events. The second part would be that we also need to think about prevention. So we need to prevent COPD exacerbations occurring in the first place, and in that way we can then reduce associated cardiovascular events. And we also need to think about doing regular risk assessments for exacerbations and for those cardiovascular events. And then finally, and most importantly, we need to take action. So once an exacerbation occurs, we need to consider that patient to be high risk and take the opportunity to intervene. And we need to intervene with the appropriate guideline-directed inhaled therapies. And we also need to intervene by making sure that those patients are on the appropriate cardiovascular medications as well.